Welcome to Simcoe Addiction and Mental Health. Today, we're going to look at the intricate nature of trauma and PTSD. We're going to touch on how this emotional response manifests itself, as well as how to cope with it and heal. We'll also touch on the type of help that is available for treating health concerns like these in the province of Ontario. Let's begin. What exactly is trauma? Trauma refers to an emotional response to a distressing or disturbing event that overwhelms an individual's ability to cope. It can leave lasting imprints on our psyche and physical well-being. It is a universal experience that can occur in individuals of all ages, genders, cultures, and backgrounds. From natural disasters and accidents to interpersonal violence and combat, traumatic events can take many forms and have far-reaching consequences. According to the World Health Organization, WHO, an estimated 3.6% of the global population suffers from PTSD at any given time. However, this figure only accounts for diagnosed cases, and many individuals may go undiagnosed or untreated due to stigma, lack of access to care, or other barriers. Despite growing awareness and advocacy efforts, the stigma surrounding mental health still persists in many societies. It's important to recognize that it isn't limited to catastrophic events, but can also stem from ongoing stressors or relational dynamics. Trauma responses can vary widely, but they often fall into four categories: fight, flight, freeze, and fawn. These instinctual reactions reflect our body's attempt to protect itself in the face of danger or distress. Its signs and symptoms can manifest in various ways, impacting both our emotional and physical well-being. Recognizing these signs is the first step toward healing. Here are a few examples of signs. Emotional and psychological trauma symptoms may include flashbacks, nightmares, anxiety, depression, and a heightened sense of fear or vulnerability. It can also have profound effects on our physical health, leading to chronic pain, fatigue, gastrointestinal issues, and even cardiovascular problems. Here are a few steps you can take to make progress toward your recovery. Seeking professional help is a major component of navigating the complexities of trauma and PTSD. Therapists and counselors can provide invaluable support and guidance on the journey toward healing. Talking to someone you trust can offer solace and validation. Whether it's a friend, family member, or mental health professional, sharing your experiences can alleviate the burden you or your loved one may carry. Writing and journaling can be powerful tools for processing emotions. Putting pen to paper allows us to explore our thoughts and emotions in a safe and reflective space. Engaging in self-care practices is essential for nurturing our mental and emotional well-being. This can include activities such as exercise, meditation, hobbies, and spending time in nature. Mindfulness techniques, such as deep breathing and guided meditation, can help ground us in the present moment and soothe our overactive nervous system. There are many treatment options available for trauma and PTSD. Here are a few choices to help point you or your loved one in the right direction. Trauma treatment encompasses a range of therapeutic approaches tailored to individual needs. From inpatient programs to outpatient counseling, there are various paths to healing. Inpatient treatment offers intensive support in a structured environment, providing round-the-clock care and access to a multidisciplinary team of professionals. Counseling provides a safe and confidential space to explore and process traumatic experiences. Therapists utilize evidence-based techniques to promote healing and resilience. There are different kinds of counseling approaches, including cognitive behavioral therapy, CBT, eye movement desensitization and reprocessing, EMDR, and somatic experiencing. Each modality offers unique insights and strategies for recovery. If you or your loved one is struggling with trauma and PTSD and aren't sure what to do next, you can start by looking for a qualified treatment center. Look for accredited facilities with experienced staff, comprehensive treatment programs, and evidence-based methods. Consider location, cost, and aftercare programs. Aftercare is a major component of recovery. At Simcoe Addiction and Mental Health, we provide lifelong support to all of our graduates, offering tailored resources, continued guidance, and free aftercare programs. If you're in Toronto, Simcoe Addiction and Mental Health offers an effective trauma and PTSD treatment program. Our inpatient center, located just outside of the city, caters to diverse needs. Whether seeking help for yourself or supporting a loved one, remember that recovery is a journey and there is hope. If you are looking for additional support, you can visit our info and support page under the Resources tab on our website. Together, we can navigate the path to lasting recovery. Until next time, take care.